U.S. President Donald Trump is maintaining his positive outlook despite having tested positive for COVID-19. He is currently receiving treatment at the Walter Reed National Military Medical Center. Now, the White House physician says the president is presently not requiring any supplemental oxygen. Mr. Trump has just posted this message on Twitter, thanking his supporters. Earlier, he also released a video saying he is doing well. It was the first time he spoke on camera since he and his wife Melania tested positive for the coronavirus.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
The president is now at the Walter Reed National Military Medical Center and is expected to stay at the military hospital for the next few days. White House officials say the visit is precautionary and that his doctors had urged the move so that he could get immediate care if needed. Mr. Trump will work from the hospital's presidential suite, which is equipped to allow him to continue his official duties. In his treatment, President Trump has begun taking the antiviral drug remdesivir. He has also been administered an experimental drug to treat COVID-19, which consists of a single dose of antibody cocktail. But what exactly is this drug about? Developed by drug maker Regeneron, it is made up of synthetic antibodies for COVID-19. Antibodies that appear to be effective in fighting the virus are first identified by researchers before they are produced in large quantities. Currently, it is not authorized by the U.S. Food and Drug Administration for emergency use. However, compassionate use of the treatment can be granted. In this case, Trump's medical staff reached out to Regeneron for permission to use the drug before it was cleared with the FDA. The company says Mr. Trump is not the first patient to be granted permission for the experimental treatment. Currently, there is no approved treatment for the coronavirus, but Regeneron's experimental drug, along with Eli Lilly's antibody treatment, are seen as the most promising candidates. Initial results show they can reduce the amount of virus particles in the body when given early in the course of infection. Now, this could possibly lead to a shorter recovery time. Our U.S. Bureau Chief Simon Marks tells us the implications on the campaign trail for the November presidential election of Mr. Trump's temporary absence.
Questions that are not really being answered at the moment, swirling around the future of the campaign. Joe Biden made announcements today, sending his best wishes to President Trump and the First Lady, urging Americans to use this as a wake-up call to take the wearing of face masks and the guidance of public health officials more seriously. The Biden campaign is suspending some of their campaign advertising. The more negative campaign ads are coming off television this weekend. Mike Pence, the Vice President of the United States, may, we are told, get involved in some of the campaigning that President Trump otherwise would have done. The Trump campaign has suspended all rallies that the president was planning to attend. You know, he's made a series of these appearances at entirely mask-free rallies that may well have contributed to the situation in which he finds himself. All of that is now off. I think we can assume that the second presidential debate, which was already hanging by a thread, given the threat of debate organisers to try and add structure to the debate that might have given the moderator a chance to mute the president's mic following what we all witnessed here last Tuesday. I think that second presidential debate is almost certainly not going to happen. It's due to take place on October the 15th. That would not be within the 14-day window of self-isolation for the president. I mean, we're sailing into uncharted territory here, but certainly from the perspective of the Democrats, carefully handled, this does provide them with an opportunity to point out once again that the president has been reckless in his handling of COVID-19, not just in terms of the American public, but now in terms of the health of himself and those people around him. But again, Joe Biden's going to have to calibrate that message, I think, very carefully over the next few days as good wishes pour into the White White House, including from many of the president's political opponents, Barack and Michelle Obama, among those today, sending their best wishes for a speedy recovery to President Trump and the First Lady.
Meanwhile, the White House says it is business as usual. While there has been no change in the White House's coronavirus protocol, officials are scrambling to limit any potential spread within the administration.
We've tested all of our core staff, and I can tell you that Mr. Kushner, Mr. Scavino, myself, a number of us have been tested, have come back with negative results, and yet at the same time, I fully expect that as this virus continues to go on, other people in the White House will certainly have a positive test result.
Now, White House economic advisor Larry Kudlow also said he believed that news of Mr. Trump's coronavirus diagnosis would not have a lasting impact on the U.S. economy.
Other heads of state have had it, Britain, Brazil, other places. I am told it's a rather light case. He will be following doctor's orders. Dr. Sean Conley, who's the best in the business. I don't think it's going to have an effect.